Have you ever wondered how the world of surgery has evolved over time? It's a fascinating journey, filled with daring innovations and life-changing breakthroughs. Our story begins with the earliest forms of surgical procedures, where the primary goal was survival, not comfort. Picture this: ancient civilizations over 5,000 years ago, practicing trepanation. This is the surgical intervention that involves drilling or scraping into the human skull. A procedure that may sound barbaric to us today, but back then it was a necessary measure to relieve pressure, treat health issues, or perhaps even to expel evil spirits. Then, we move forward in time to the age of amputations. These were not the sterile, calculated procedures we're familiar with today. Instead, they were desperate measures taken to save lives in the face of dire circumstances such as gangrene or severe trauma. Without the benefits of anesthesia or proper surgical tools, these procedures were incredibly painful and risky, but they were often the only hope for survival. Despite the rudimentary nature of these early surgical steps, they laid the foundation for the medical marvels we see today. They demonstrated the incredible capacity of the human body to heal and adapt, and they highlighted the importance of intervention in saving lives and improving health conditions. But these were just the beginning. The world of surgery was about to embark on a revolution underpinned by a better understanding of the human body and the invention of tools that would allow surgeons to intervene with greater precision and safety. From trepanation and amputations, we've come a long way. Today we have surgeries that are minimally invasive, robot-assisted, and even guided by virtual reality. But none of these would be possible without the brave first steps taken by our ancestors. So let's delve deeper to understand how these surgical procedures paved the way for more sophisticated innovations. The journey of surgical revolution is not just about the tools we've developed, but it's also about the courage, ingenuity, and determination of those who dared to venture into the unknown for the betterment of human health. Imagine undergoing surgery without any pain relief. Sounds terrifying, doesn't it? Luckily, we don't have to experience such a nightmare, thanks to the revolutionary inventions of anesthesia and antiseptics. The journey towards painless surgery began in the mid-19th century when ether was first used as an anesthetic. This groundbreaking event occurred in 1846, when a dentist named William T.G. Morton demonstrated the use of ether to put a patient into a sleep-like state during a surgical procedure. This was a game changer. For the first time in history, patients could undergo surgery without experiencing the excruciating pain that was once considered an inevitable part of the process. But anesthesia was only half the battle. Even if a patient didn't feel the pain during surgery, post-operative infections were still a major concern. This is where Joseph Lister comes into the picture. In 1867, Lister introduced carbolic acid as an antiseptic. Inspired by Louis Pasteur's germ theory, Lister believed that keeping the surgical field free from germs could drastically reduce infection rates, and he was right. By sterilizing surgical instruments and cleaning wounds with carbolic acid, Lister made surgery safer and more successful. These inventions, anesthesia and antiseptics, were truly transformative. They turned surgery from a last resort, often equated with a death sentence, into a more bearable and often life-saving procedure. They reduced the pain and the risk, making it possible for surgeons to perform more complex operations, and for patients to have a fighting chance at survival. These were significant milestones, but surgical science didn't stop there, it continued to evolve. Could you imagine a time when surgeries didn't require large incisions? The advent of minimally invasive surgery has truly revolutionized the medical world, making this a reality. Our story begins in the early 20th century with the invention of laparoscopy. This technique allowed surgeons to operate through small incisions, rather than having to make large, potentially damaging cuts. But how did it work? A laparoscope, a long thin tube with a high-intensity light and a high-resolution camera at the front, was inserted through an incision in the abdominal wall. This allowed surgeons to view the organs on a screen and perform surgery without having to open up the patient's body. The benefits of laparoscopy were soon apparent. Firstly, there was significantly less pain post-surgery. This was because smaller incisions meant less damage to body tissues and muscles. Patients also experienced fewer complications, such as surgical site infections, which were a common problem with open surgeries. Another major advantage was the reduced recovery time. With traditional surgery, patients could expect to spend weeks, if not months, recuperating. But with minimally invasive surgery, patients were often up and about within days. This was a game changer for people with jobs, families, and responsibilities that they couldn't put on hold for an extended period. But the benefits weren't just physical. The psychological impact of smaller, less visible scars cannot be underestimated. For many patients, the thought of a large visible scar was a significant source of anxiety. Minimally invasive surgery helped to alleviate these fears, making the surgical experience less daunting. It's important to remember that, like any surgical procedure, minimally invasive surgery does have its risks. However, the benefits often outweigh these, making it a popular choice for many procedures today. With the invention of laparoscopy, the surgical world was forever changed, but the best was yet to come. This marked the beginning of a new era in surgery, one that prioritized patient comfort and quick recovery, setting the stage for even more groundbreaking inventions in the future. What if a robot could perform your surgery with precision beyond human capabilities? Welcome to the 21st century, where this is not a hypothetical question, but a reality. The rise of robotic surgery has revolutionized the medical field in unprecedented ways. In the late 20th century, a groundbreaking invention emerged: the Da Vinci surgical system. Named after the famed Italian inventor, Leonardo da Vinci, this advanced piece of technology changed the surgical landscape forever. The system was designed to facilitate complex surgery using a minimally invasive approach, and it was a game changer. The Da Vinci surgical system is not an autonomous entity, but rather an extension of the surgeon's capabilities. Through a console, the surgeon controls the robot's arms, which can rotate and bend with a range of motion far beyond that of a human hand. This allows for precision that was once thought impossible. And it's not just about precision. Robotic surgery offers a multitude of benefits. First, it provides surgeons with enhanced visibility. The system's 3D high-definition vision system gives surgeons a highly magnified, unprecedented view of the surgical field. Secondly, robotic surgery allows for greater flexibility. The robotic hands can rotate a full 360 degrees, eliminating the limitations of the human wrist. This means surgeons can perform complex procedures with more ease and less strain. Lastly, there's the advantage of control. The Da Vinci system filters out hand tremors and scales down the surgeon's hand movements, which allows for extreme steadiness during the procedure. This level of control reduces the risk of complications and can lead to better patient outcomes. The introduction of the Da Vinci surgical system and the rise of robotic surgery was a turning point in the history of medicine. It's a testament to how far we've come and how the blend of technology and human skill can lead to remarkable achievements. Despite the incredible advancements of robotic surgery, the world of surgical innovation doesn't stop there. What does the future hold for surgical inventions, you might ask? Well, let's delve into the realm of possibilities and explore some potential developments in surgical technology that are currently on the horizon. First, imagine a world where microscopic robots or nanobots are performing surgeries. These tiny marvels of technology could navigate through our bodies, repairing damaged cells, unclogging arteries, or even destroying cancer cells. The precision and efficiency of these nanobots could significantly reduce risks associated with conventional surgical procedures like infection or human error. Now let's shift our gaze to another exciting development: the 3D printing of organs. Yes, you heard that right. Scientists are working tirelessly to perfect the art of printing fully functional organs. This could eliminate the need for organ transplants from donors, thus reducing the waiting time for patients in dire need. Picture a world where a failing heart, liver, or kidney could simply be replaced by a 3D printed version. It's like science fiction, isn't it? But it's closer to reality than you might think. And then, there's artificial intelligence, or AI. Imagine an operating room where AI is guiding surgeons, providing real-time data and predictive analytics to help them make the best decisions during complex procedures. This could significantly improve patient outcomes, reduce recovery times, and even save lives. But it's not just about the technology itself, it's about how these inventions could revolutionize the field of surgery. They could make surgery safer, more accessible, and more effective. They could change the way we view disease and treatment, shifting our focus from reactive to proactive healthcare. While we can't predict the future of surgical inventions, one thing is clear: the journey of surgical innovation is far from over. And as we continue to push the boundaries of what's possible, who knows what incredible inventions await us in the not-so-distant future? The possibilities are truly endless, and the future of surgical inventions is an exciting frontier that we are just beginning to explore.